Hello, Jack. How are you?
Hi, yeah, I'm good, thank you. Thanks for having me.
Can you please introduce yourself and tell us about your area of research?
My name is Jack. I'm a second year PhD student, and my project aims to look at mutations within the GP1B95 complex, which is a receptor on the platelet surface, which helps the platelets to stick to injury sites on the vessel wall. And I'm funded by Compare.
Why is your research important?
So the research is important because we have a series of patients who are recruited to a study called the GAP study, which stands for genotyping and phenotyping of platelets. These patients are recruited because they have bleeding symptoms, but we don't know the cause of them. And so it's important for us to try and establish why these patients bleed and how this is different from the more standard diagnosis.
And what progress have you made so far?
So far in my project, I have identified and evaluated a series of mutations to the complex in GAP patients, and picked some that we think are interesting to study. And we've also had one of these patients come back and give us a blood sample, which I've then gone on to study for a range of different things, such as aggregations, to help us try and further establish what's going on in her platelets.
Good. And tell us, what do you enjoy about the research?
So the best thing about my project is obviously we're trying to fully establish what's going on, and so the most enjoyable thing is the range of different techniques I get to use, but also the fact that this is affecting a patient, so it feels like there's a direct benefit, and so that's quite nice as well.
Finally, what is your longer term ambition?
So long-term ambition would be to kind of fully understand what the GP1B alpha protein and the GP1B95 complex does, and maybe help us better understand how it contributes to bleeding.
It's a good ambition. Thank you so much, Jack.
No problems, thank you.
Cheers.